a minute.
Do we have sound now?
We have. I think we have sound now. Well, it's hard to tell when you're not saying anything. So just...
Okay, do over.
Welcome. We are Empowerment Nursing, and today we're here to talk about and show you IV made easy. IV fluids made easy.
So before we get started, sorry about the technical difficulties. If you're having a little bit of trouble viewing this, that's okay. We're going to take a picture of it once I fill in these blanks here, and we're actually going to post it below the live video, so you'll be able to get a screenshot of it later. So before we get started, please feel free to comment, let us know your name, where it is you're joining us from. There is a coupon code right now, it's summer17. That can be applied to our website. That does, I just want to mention, it does expire today at midnight. So if you're thinking about taking our program, now would be the time to register. Because we want to make sure that you take advantage of that $50 off. Our website is www.n-powermentnursing.com. You can go there anytime. It's posted right down there. I can maybe touch it if I come this way. Right down there, n-powermentnursing.com. So please visit our website to find out a little bit more about us. What else do I need to say before we get started? There's a couple other things I'm just trying to remember. They'll come to me when I think of them. I'll throw them out there. So please like and share this video. It's really important to us that we meet new people, and this is really going to help a lot of nursing students that perhaps you know well by sharing this video. So we wanted to kind of do a new type of live video that's not just us talking, and we want to actually demonstrate to you how it is that our program works. So our program works this way. We do a lot of interactive teaching on the board to simplify very difficult concepts. So today we're going to show you basically how it is that we do that. And one of those very difficult concepts, even for Linda and myself, tenured nurses, practicing nurses, nursing students, as well as nurse graduates, is IV fluid replacements. So usually before we teach this, we kind of take a poll in the room as to who really finds this a super difficult concept. And the feedback we get is basically everybody. Everybody is very afraid of IV solutions. They don't really understand how they work when you put them in the body, what you would monitor when you use them, etc. So this is exactly how we teach IV fluid replacement in our textbook as well as through our live and online review. So we just wanted to share that with the Facebook public today. So I want to prove to you today that IV fluid replacement is not difficult, and you don't need to memorize. You'll see all of these numbers. Numbers are very daunting to nurses, right? We have a lot of numbers in our minds. So numbers are something that are very daunting. And a lot of people just don't learn this and they opt out of it, I like to call. We don't want to opt out of any learning. So we're going to start with isotonic, and I'm going to prove to you that if you know the isotonic IV solutions, you can know the rest of the solutions as well. And this is evidenced by the IV isotonic solutions. If you know these three, 0.9% sodium chloride, D5W, and lactate ringers, the hypo and the hypertonic solutions are going to make perfect sense to you. So just know these three different solutions. Again, 0.9% sodium chloride, D5W, and lactate ringers. And when we do the other kinds, I'll demonstrate to you how you're going to know what is hypo and hypertonic to that. What does isotonic mean by definition? So isotonic by definition means the same as, okay? So isotonic solutions are the same as the blood that's flowing through our vascular space. Therefore, when we put isotonic solutions into our bloodstream, say you put an IV in somebody's arm and you're going to infuse an isotonic solution, one of these three solutions, it's going to stay where I put it. So a key way to remember isotonic solutions is this. ISO stays where I put it. ISO is where I put it. And what does that mean? That means if you take an isotonic solution, I'm just going to draw this. So this is our isotonic solution, okay? If you put that isotonic solution into somebody's vascular space, meaning their vein, it's just going to stay in that vascular space. It's not going to move into the cell at all. So it's going to have no effect on the body cells, okay? ISO is where I put it. So it's going to stay exactly where you put it into the person's vascular space. So when do we use this? Well, we would use this when we want to replace the fluid in their vascular space. Different reasons why people might lose fluid in their vascular space. If there's been a trauma, right? If they've lost blood, they've lost circulating volume. different traumas such as this. So when we want to replace this fluid. So here's the key thing though. When we are putting isotonic solution into somebody's veins and it's staying there, whenever you increase the volume of your hoses, I like to call them, in your body, you're also increasing pressure. So the people you would not want to give an isotonic solution to are those people who are cardiac patients, renal patients, and especially those with hypertension. As you can see, it says here, this stays in the vascular space and it can therefore cause fluid volume, excess and hypertension. So you would caution giving this to cardiac or renal patients. Let me break that down to you even simpler. If you want to increase the water pressure in your shower, what you do is you increase the volume, you turn up the tap. If you're watering your garden and you want to increase the water pressure in the hose, you go and you turn up the tap on the hose. So you increase the volume, which increases the pressure. So the hoses in our body works the exact same way. So isotonic solutions is where I put it. Stays in the vascular space, increases volume, therefore pressure. Therefore, you don't want to give that to any cardiac or renal patient. Another thing that distinguishes isotonic solutions is this one in particular, 0.9% sodium chloride, you'll notice down here, is the only solution ever that is compatible with blood, okay? So that's isotonic solution, and that's where we start. Now, if you know these three solutions, so if you know 0.9% sodium chloride, D5W, and lactate ringers, it makes hypotonic solution very easy to understand. You'll notice here, 0.33% sodium chloride, is that less than 0.9%? Yes, it is. Hypo means less than. D2.5W, right here, is that less than D5W? Yes, it is. Hypo means less than. So you don't need to memorize all of these numbers, you just need to compare them to the isotonic solutions. So now that we know that these are hypotonic, let's talk about how hypotonic solutions behave in our vascular space. So a quick awesome way to remember this is hypotonic brings it out. You can see the O's. Hypo equals out of the vessel and into the cell. And when that happens, the cell will swell. So it looks like this. Now we have a hypotonic solution. We're going to draw hypo. We're going to put that into the vascular space. It's going to go into the vascular space, into the cell, right into it, and the cell is going to swell up like this. Okay? So hypo out of the vessel into the cell, causing the cell to swell up. With that knowledge in mind, we use this for dehydration. We use this to rehydrate the cells. So think critically about this now. This hypotonic solution isn't staying in the vascular space. It's not increasing the volume and it's not increasing the pressure. So this would be a safe solution to give to the renal or the cardiac or the hypertensive patient. Because it leaves the vascular space, it will rehydrate the cells without causing hypertension. It's used for hypertensive and renal patients. It is also used to treat hypernatremia, and that's because if somebody has hypernatremia, that means high sodium concentration. The last thing you would want to do is give them a high sodium concentrated solution, so you would give them a hypo or low sodium concentration solution. Also, if we are bringing the fluid out of the vascular space and into the cells, our primary assessment then, which should make sense, would be to monitor that patient for edema because the cells are swelling. Okay, so that's hypotonic. Now moving over here to this side, the last column is hypertonic solutions. So if you look at these solutions, you can see 3% sodium chloride is greater than 0.9%. Therefore, hyper, which means more than, tonic. D10W greater than D5W, which makes it hypertonic. D5 lactate ringers is greater than just lactate ringers, which makes it hypertonic. Hyper means more than. So let's talk about how hypertonic solutions behave in the body. So if you're putting a hypertonic solution into the body, an awesome way to remember that is this. hypertonic enters the vessel out of the cell. So, to demonstrate, and pictures are so valuable and they work so well. So draw this out yourself. So we have hypertonic now. We're putting this solution into the vascular space. And what's going to happen if this is our cell, it's going to draw the fluid. Whoops, apparently I can't draw an arrow. It's going to draw the fluid from the cell and actually reverse it back into the vascular space. And what's going to happen to our cell is this. Our cell is going to shrivel up and shrink because it's drawing the fluid out of our cell back into the vascular space. So, with that in mind, again, just like isotonic solution, we're now bringing more volume back into our vascular space. And what's going to happen when we increase the volume is we are going to increase the pressure. So, who would we not want to do this to? We would not want to do this to, again, our hypertensive cardiac and renal patients because we are bringing fluid back into the vascular space. So when would we want to do this? Well, we would want to do this if we wanted to take the fluid out of the cells. For example, if a patient had peripheral edema, we would want to take the fluid out of their third spacing and their edema and bring it back into their vascular space, and we do that with a hypertonic solution. Now we have to be careful because when we're doing this, it can cause fluid volume excess as well as hypertension, okay? It will return any third spacing, so burns, right, ascites, any peripheral edema, etc. is when we would want to use this. Now on a side note, a hypertonic solution, meaning a high sodium concentration, would be used to treat a hyponatremic patient that has low sodium, okay? So that is it in a nutshell. That is how simplified IV solutions can be. And I hope we've proven to you that if you can draw these three pictures and you can know just the three isotonic solutions, the rest of it just makes natural sense. So Linda's going to talk a little bit about why this is the most brilliant way to study content and why it works so incredibly.
We call this a side-by-side, and this is similar content on a side-by-side. If we were just to study this separately, so this being column A, column B, and column C, and we studied this by itself, and then 45 minutes later we studied this by itself, and 45 minutes later we studied that by itself, it isn't going to get into your memory quite as well as studying it like this, where you have the A and the B and the C, and you're looking at C and go back to A, then look at A and B and A and C, and have the whole picture all at once. We have a blog, actually, that you might want to look at called The 5 Top Ways That Nursing Knowledge is Tested. And in that blog, our fifth way is commonly nursing knowledge is tested using concepts that are different. And so it is very key to have this all on one page because what happens is it pops out at you. The differences between these three pop out at you as opposed to having them just on single pages and studying them separately. It's kind of like thinking that your memory is trapped in a forest. And what you're doing is you're creating pathways to that forest. When you study them separately, that pathway is not as clear. It's got some weeds in it, perhaps some poison ivy. It's not going to work as well. When you study it all in one big picture like this, the pathway to that forest, to your memory, is clear. It's defined. And this is because you're making connections between this. You're able to make a pathway that involves deep critical thinking and understanding when you can bring it all together like this, so that you can reach down that path into that forest of your memory and pull out these concepts to remember them for test questions.
And just to show you, and something we do in our online and our live review is this. Let me prove it to you. So now after watching this, it's been what, maybe 10 minutes that we've been talking about this. If I were to ask you which one of these is safe to give to a hypertensive patient, there's only one, and that is hypotonic. Do you see how that difference stands out, right? If we were to say, Which one of these treats hypernatremia? There's only one, and that's this. It stands out as different from the rest. Which one of these would edema be your primary assessment? There's only one, and it's this because it stands out. This keeps on going. There's only one of these that is compatible with blood, and that would be isotonic. There's only one of these that you would use for burns and edema to return fluid from third spacing, and that is hypertonic solution. So you can see how when you study it like this, you can anticipate how questions will be asked on your registration exam, and you're going to know the answer 100% because you've critically studied it. Side-by-sides allow you to pull out the differentiating concepts, which is what is used to test your knowledge and those your ability to deeply critically think. So this works so incredibly well. And when we teach students, especially in a live review throughout those 4 days, of course, this knowledge translates into so many other diseases. So throughout the other diseases in our textbook, we're able to say, okay, now let's think about that. If our patient is a burn victim, say, for example, which type of IV fluid would you want to give them? And every student in that room knows it would be hypertonic solution, because they know that is the only one that's going to return the fluid from the cells and third spacing and bring it back into the vascular space. Okay? Very effective, works very, very well.
Absolutely, and not to despair. We know that the harder it is to study, the harder it is to bring these concepts together for you, the deeper your knowledge level, the deeper retention, the better it is to be able to reach back into that forest of your memory and bring that memory back, okay? Studying really easily and just, rereading content, that does not create a solid path to that forest, okay? And this is just kind of one page of our textbook, one page of our example that we've brought forward tonight around the critical thinking that goes into every page of this book.
So this is how we teach everything. A lot of students, we do have a full, complete online live review, and basically it's 90 days access to the teaching of this entire textbook. We teach every chapter of the textbook, every body system, psych, maternity and nursing, maternal newborn, every topic that is covered on the NCLEX and the CPNRE within this book, and then we teach it. And this is how we teach it. And I feel like it's worth mentioning because a lot of students are afraid of online learning because they assume that it's going to be sitting at a table with a PowerPoint, right? It's nothing like that. It's completely interactive. We're on a blackboard. We're drawing pictures just like this. This is a great example of how we teach this entire textbook to you. So we invite you to ask us more questions. Check out our student testimonials and our feedback. We have 100% student satisfaction. And a 99% pass rate, which also includes anybody that hasn't been successful on the NCLEX up to 7 times. So what we do is very, very effective and very rewarding. And we invite you to please like and share this video. Share it among all of your nursing friends because I feel like this is a topic everybody struggles with. And this is really going to help so many people if you like and share this video, because this is a real struggle for not just nursing students and nursing graduates, but also nurses who are currently in practice. So please check out our website. It's wrong way. It's right down there. You can see it right there. It's really awkward to point backwards. But that's our website right down there. And we do have a coupon code right now, again, summer 17, and that is for $50 off our complete program. And as per usual, thank you so much for joining us. And we're just going to leave you with our favorite Nightingale quote,
which is, "Let us run the race where all may win, rejoicing in their success as our own, and mourning their failures wherever they are as our own. We all are all one nurse."
Hence our t-shirts.
We're all one nurse.
We are one nurse. Thank you so much for joining us, and we will be posting a picture of this right now, so don't fret if it's got a little bit of glare on it. We really struggled with the lighting because, as you know, we're usually in our cafe. So we will post a picture of this suite. Thank you so much, and have a great night.
Don't give up.